Hey guys, welcome back to my YouTube channel. And let's go ahead and continue with the salivary glands. We studied till necrotizing metaplasia last time, and the next slide that we will be talking about today is the infectious sialenditis. Now let's go ahead and just before going ahead, I just want to mention here that it is not an important slide, but during INBDE exam you do see these options in the questions like infectious sialenditis. So I'm just adding these like small slides just to know to help you guys with what it means or what it actually is. So what is infectious sialenditis? As the name suggests, it is an infection, and it is an infection of the salivary gland, and infection could be either bacterial or viral infection. Now, it affects major glands more than the minor glands. So, major glands are more commonly affected, like the parotid glands, submandibular and the sublingual glands, as compared to the minor salivary glands, which are found in on the palate or the lip. Now, bacterial sialenditis can be split into acute and chronic. Now, as we already know the meaning of the word acute and chronic, acute means a sudden onset, chronic means a slow onset. Acute infectious sialenditis are more common in the parotid gland, and 25% and 20% of the time it could be bilateral. Chronic is due to a recurrent or a persistent ductal obstruction. So whenever there is a ductal way obstruction, the infection is going to build up slowly over time, and hence the name chronic. Now, the next topic that we'll be studying today is the mumps. So I have mentioned this another name over here, which is known as epidemic parotitis. So this is a common name that sometimes the INBDE exam tries to confuse the students. You might know what mumps is, you might have actually studied about mumps, but you do not know the other name of the mumps, which is epidemic parotitis. So if you see this name in the options, do not worry, because this is mumps. Now, it is an acute viral infection which is caused by paramyxovirus. Now, some students, while I teach them, they ask me like, why are we not studying NBD part 1? So I always mention that the exam INBD is now more about clinical questions. Like, they will ask you part 1 questions, but more in the clinical point of view. So this is like an example here of an NBD part 1 question could be asked, like, mumps are belong to which class of the virus? So they belong to the paramyxovirus. So this is how the INBD exam is actually changed. It is more clinical based. They might ask you questions about NBD part 1, but more in the clinical point of view. Again, I'm going to start with, it is an acute viral infection caused by paramyxovirus. The virus can be acquired by respiratory droplets, saliva, and urine. It is associated with acute viral sialenditis. We just studied about it in the previous slide. Infectious sialenditis can be viral or bacterial, so it is acute and viral. 90% occur in parotid gland and bilateral in 2/3 of the cases. So, what are the symptoms? There will be sudden salivary gland swelling, but without the purulent discharge. So, there is going to be no discharge here. And another symptoms associated with mumps are mild fever, malaise, and anorexia. Most cases are self-limiting, and a common age that they can be seen is up to 14 years of age. Now, let's go ahead, and this is just a picture of the mumps, and you can see here there is a parotid gland swelling in a child, and this is also known as epidemic parotitis. Now, the next slide that we're going to talk about today is Mucus disease. Now, what is Mucus disease? Like most of the students do have studied before I start teaching them, and they have studied most of these salivary glands, but there are some things called the topics they haven't covered, something called as Mucus disease. It is an important topic. Again, it is a benign asymptomatic enlargement of it. Either it could be salivary or the lacrimal glands. The cause is basically unknown, but it could be autoimmune as well, according to the books. Initially, it starts unilaterally, but can become bilateral in 20% of the patients. Again, more commonly, it is found in females, and the age is 50 years. Now, this is a point like I normally add in the slides about the histological point of view. Histologically, you will see the gland parenchyma is replaced by lymphocytic infiltrate. because it is an autoimmune disease. So there is an infiltration of the lymphocytes within which they are scattered epimyoepithelial islands. Most cases remain benign, but there is some chances of malignant transformation. Treatment is immunosuppressive. Why? Because it is an autoimmune disease, so we give something to suppress our immune system like corticosteroids. Here is a beautiful picture of a mucolyx disease. It, like as I mentioned, that it is more common in women. So it is a picture of a woman, and there is a lacrimal and a salivary gland enlargement. So the next topic that we will be studying, and again one of the very important topics from INBDE exam, is Sjogren syndrome. So I will be paying a little more attention on this topic. So it is again an autoimmune disease, and it is chronic, and it will involve salivary and the lacrimal glands. So three things that are associated with the Sjogren syndrome are xerostomia, which is dry mouth, keratoconjunctivitis sicca, which is dry eyes, and possible salivary gland enlargement. So please do remember these 3 points. Again, it occurs more commonly in females. There are 2 types of Sjogren syndrome, primary and secondary. Again, very important this point over here. The secondary form is associated with other 2 autoimmune disorders, which are systemic lupus erythematosus and rheumatoid arthritis. Please guys do pay attention. This is a commonly asked question in INBDE exam. Now, signs and symptoms include difficulty in swallowing, altered taste, and difficulty in wearing dentures. These are all because of xerostomia or dry mouth. The oral mucosa may be red and tender. The tongue becomes fidget and atropic. There is decrease in salivation, which may cause rampant caries. This is another question. They might give you a case where they'll mention all these signs and symptoms, rampant caries. They might say that the patient has difficulty in swelling and all this, and you know from these points that it is Sjogren syndrome. So the next one, here is a picture of the Sjogren syndrome. Here you can see that the oral mucosa is red and tender, and the tongue is fidget and atropic. So, sorry, I missed a slide here. So let's talk about this slide as well. So the laboratory findings may include autoantibody rheumatoid factor, which is anti-nuclear antibodies, which are anti-SSA and anti-SSB. Please guys, very important point. Again, they love to ask this question, which autoantibodies are associated with Sjogren syndrome. They are anti-SSA and anti-SSB, and the factor is rheumatoid factor. Please do pay attention and mark these important points. It is a commonly asked question. Now, cialography often shows punctuate cialactasia of the ductal system, typically a fruit-laden branchless tree pattern. Not a very important point, but still I mentioned it. Histologically, again, it is an autoimmune disease. You will see lymphocytic infiltration of the salivary gland, which result in the destruction of the acinous cells. Acinous cells are commonly found in the salivary glands. Again, this is the same picture that I just mentioned earlier. The oral mucosa is red and tender. The tongue is fidget and atropic. Now, let's go ahead and talk about Sacro Iodizes. Now, what is thus Sacro Iodizes means? They are enlarged mass or granulomas that can occur in any part of the body, but when they are associated with salivary glands, they are known as Sacro Iodizes. So the signs and symptoms include fever, fatigue, anorexia, or weight loss. When the granulomas involve the salivary gland, they can mimic the symptoms of Sjogren syndrome, which is dry mouth, dry eyes, and salivary gland enlargement. And it is associated with rheumatoid factor and autoantibodies anti-SSA and anti-SSB. I'm just mentioning these points again so that you guys remember these points. Intraorally, it presents a submucosal mass, area of granularity, or ulceration. Treatment: without treatment, otherwise corticosteroids are the treatment of choice. Now, let's go ahead and talk about some tumors of the salivary gland. One of the most common one talked about in dentistry and even the exam point of view is the pleomorphic adenoma. It is the most common salivary gland tumor, both major and minor glands. So please Mark this point, important point, it is both major and minor salivary gland, most common salivary gland tumor. It is a mix of ductal epithelial and myoepithelial elements within a mesenchymal-like background. Extraorally, it occurs 85% in the parotid gland. So parotid gland is the most common site. Intraorally, it is the posterior palate. It is a slow-growing, painless and firm mass that is smooth or lobulated. Since it is benign, so it will be well circumscribed and encapsulated tumor. However, the capsule may be incomplete or show infiltration by the tumor cells when around 3 to 4% show malignant transformation, because in some cases the capsule can be incomplete. So that's why some sort of malignant transformation is possible. Treatment is again by surgical excision. Now, this is another picture of the pleomorphic adenoma. Parotid gland is more commonly associated, more common in females, and it is a slow-growing enlarged mass. Now, the next one we're going to talk about is the monomorphic adenoma. Again, not an important slide, but just a name, that's a small slide that so that you know what does it mean. It is an umbrella term which is used for tumors showing a more uniform histopathological pattern compared to that of pleomorphic adenoma. So it is an umbrella term. So in some classification, the term is used as synonym for just basal cell adenoma or canalicular adenoma. So when you combine these two adenomas, so then you can just give a umbrella term which is the monomorphic adenoma. In other classification, it may include a variety of tumors, and it could include basal adenoma, canalicular adenoma. Basal cell adenoma is found primarily in the parotid gland, which is the major salivary gland, canalicular in minor salivary glands on the posterior palate and the lip. Now, let's talk about Watkins tumor. Again, I have mentioned the another name for Watkins tumor is the papillary cyst adenoma lymphomatosum. Again, it is a benign neoplasm that occur exclusively. Now, it is I have mentioned the word exclusively here in the parotid gland. Occurs less commonly than pleomorphic adenoma, since we are comparing it with pleomorphic adenoma because both of them are benign neoplasms. Most common in older adults, and male to female ratio is 10:1. Please pay attention on this point. This is one question they ask, because most of the cases that we studied in salivary glands since last slide and today's slides, the most commonly they occur in female. So this is the only one that occurs in male, and the ratio is 10:1. It is a glandular encephalitic tumor which is lined by bilayered epithelium and a lymphoid stroma. Clinically, non-tender, slowly enlarging, firm to fluctuant nodule over the angle or the ramus of the mandible. These are the locations. Treatment is again surgical removal. Again, I have this picture. Here it is the male. It occurs in male, and the ratio is 10:1. Now, next one we're going to talk about is adenocarcinoma. Any term that ends with carcinoma means it is aggressive. It is malignant or sarcoma. Rare but aggressive tumor. About half of these tumor present in the parotid gland. Patient will complain of pain or facial weakness at presentation. Firm mass with irregular borders and infiltration into surrounding tissue. Treatment is via the surgical excision. Because it is a carcinoma, it is aggressive, so it has to be surgical excision. Next slide is about the adenoid cystatic carcinoma. Again, the word is carcinoma to be paid attention. Now, 40 to 45% occur in the minor salivary glands of the palate. In major salivary gland, the parotid and the submandibular are most commonly affected. 3 histological patterns can be seen: cribiform, tubular, and solid, out of which cribiform or Swiss cheese pattern is the most common one. Let's talk about mucoepidermoid carcinoma. It is an important one. Questions do come on this from INBDE point of view. And as the name suggests, muco and epidermoid means mucus cells, and the epidermoid cells are the 2 most common population of cells found in this carcinoma. And it is the most common malignant tumor. So the most common benign tumor was pleomorphic adenoma, and most common malignant tumor is the mucoepidermoid carcinoma. It is found both in minor and major salivary gland. Developed most commonly in the major salivary gland, most often the parotid, which is 45 to 70% present as asymptomatic swelling. Second most common site, which is the minor salivary gland, is the palate. two, as I already mentioned. Two major population of cells found are the mucus cell and the epidermoid cells. Now the last slide we will be talking about today, again it is just a small slide, so you know what, if you see it in the options, what does it mean. Ethnic cell carcinoma. It is the second most common parotid malignancy and the second most common pediatric salivary gland malignancy. Just a small slide, just one point only, so in case if you see it in the options, you know what it means. So this was all for salivary gland tumor, guys. So I will be coming back again with another oral pathology topic, and so please do not forget to subscribe my channel INBDE tumor if you have a INBDE tutor. Sorry guys, just talking so much about tumors. And you can also follow me on Instagram, which under the same name, INBDE tutor. So have a great day. Bye.